Hello and thank you for joining us. I'm Wilson Stribling. Welcome to another edition of At Issue, where we discuss and debate the critical issues facing the state of Mississippi and how these issues impact you. And we want you to share your opinions and comments with us. Just go to facebook.com/MPB Online News. On Twitter, our handle is @MPB News. Also visit our webpage, mpbonline.org/issue. At issue tonight, Zika and West Nile Virus, two harmful illnesses people contract when bitten by infected mosquitoes. The new threat of Zika is raising concerns for mothers and unborn children. It's putting the American public and health officials on alert. While West Nile virus is an old enemy, well established in Mississippi, still debilitating and sometimes deadly. As of mid-September, the U.S. Department of Health and Human Services reports more than 20,000 cases of Zika in the U.S., District of Columbia, and U.S. territories. And there are nearly 1,900 pregnant women with evidence of the Zika virus. The Mississippi Department of Health reports 21 cases of Zika in our state, all travel-related. Pregnant women are being advised not to travel to areas where Zika is being transmitted, such as Mexico, South America, Central America, the Caribbean, and the Miami, Florida area. The state health department says people who travel to those areas should avoid exposure to mosquitoes for 3 weeks after they get home. Zika can also be spread through sexual contact. Health officials say people returning from Zika hot zones need to protect themselves and their partners from spreading the virus, especially pregnant women. Joining us now is Dr. Paul Byers. He is the state epidemiologist for the Mississippi Department of Health. Dr. Byers, thank you for being with us on At Issue.
Absolutely.
What exactly is Zika?
Zika is a mosquito-borne viral illness. That means it's a virus that's transmitted through the bite of an infected mosquito. And it can cause an illness. It can cause symptoms of fever, rash, conjunctivitis, sometimes some joint pain. For most folks who are infected, it's a relatively mild illness. About 80% of folks who are infected don't even have any symptoms. But it does have an impact on pregnant women and the developing babies. And the infection during pregnancy can lead to some pretty significant birth defects.
Let's go back to, do we know where Zika came from, where those first mosquitoes who had it, how they got it?
Well, Zika's been around for a long time. It was first identified back in the 40s in Africa, and it has not caused a whole lot of human illness since that time. It has caused some relatively large outbreaks, but certainly nothing on the scale that we're seeing now in South America and Central America and the Caribbean.
And these cases that we have in the U.S. were all brought here by humans who were infected by mosquitoes in some of these areas you mentioned, correct?
Yeah, travel-associated cases, and we kind of figured that we were going to have them with what was going on in those areas where there's active transmission. But those are the primary cases that we're seeing in the U.S. right now. There are a couple of areas, obviously, in Miami where they've seen local ongoing transmission.
And in that respect, you're talking about a mosquito who's capable of carrying the Zika virus can actually bite a human who is infected with Zika,
right,
then become infected itself, bite another human, and transmit the disease to that human. Is that correct?
Right. So a mosquito would have to bite that infected person at just the right time when they had virus in their blood. And we think that that's about 7 to 10 days after somebody becomes infected. Mm-hmm. And then that would have to be the right type of mosquito, and then that mosquito would have to incubate that virus and then be able to transmit it to another human through a bite. But that's how it works, and so this is in a mosquito human to mosquito cycle.
A lot of things have to line up just right for that to happen, but that is what's happening in Florida, right?
It is.
And what are the chances that will happen here in Mississippi?
Yeah, we hope that it doesn't happen, and that's certainly one of the things that we're working on through our prevention messages to make sure that people understand that. We don't think that we have the type of mosquito that's primarily transmitting this virus right now, but we do have a closely related one in Mississippi for sure. And so we want to make sure that people who come back from areas where there's ongoing transmission. Do avoid those mosquito exposures so we don't run the risk of our local mosquitoes becoming infected.
You talked about the symptoms. What specifically can happen with a woman who is pregnant if she is infected with the Zika virus?
Well, that infection can then infect the baby. Okay, and that can have some devastating effects on the baby, especially with the brain development and growth. And babies born to infected mothers can have some very significant birth defects. Microcephaly is a condition where the baby's head is small, and that's primarily because the brain has not developed well. But there can be some other birth defects as well, hearing loss or hearing impairment, visual impairment. So there can be some other devastating things that we just don't have a good handle on how long those things may develop after someone is infected.
What if a woman has been pregnant for a while? She's late in her pregnancy, near her delivery date, and is then infected. Is there a point where the baby can be developed enough where it's no longer a concern?
I don't know if we know all of that for sure, but we do know that most of the serious problems can occur when a woman is infected early in her pregnancy. But it has been shown that if a woman is infected any point during her pregnancy, even in the later stages, it can still have an effect on that developing baby.
Let's talk more specifically about microcephaly. That's the condition we've heard the most about as it relates to newborn babies who were born to infected mothers. Tell us a little bit more about what microcephaly is.
Well, like I said, microcephaly is a very small head in these babies, and there can be a spectrum of microcephaly where some of the babies have more significant effects than other babies do. But again, it's a condition where the brain has not developed appropriately, especially the frontal part of the brain. And these babies can have some very devastating birth defects as a result of that impaired brain growth.
And it can affect that child's development and even lifespan, can it not?
It can, and some of those babies regrettably don't live. And, you know, there is evidence now that problems can develop even later after a baby is born that shows that if a baby is normal at birth but is born to an infected mother, that those babies may develop some problems later on.
We hear a lot about pregnant women being the ones who have to be most concerned about this.
Yeah.
Does that mean that the rest of the population, it's not as big of an issue, that it's not as big of a threat?
That's a great question. You know, I think you bring up a good point. For pregnant women, certainly that is a group of folks that we want to make sure that they understand that if you're pregnant or you're planning to become pregnant, travel to these areas where there's ongoing active transmission is absolutely not recommended, just to not run the risk of infection during the pregnancy. For people who travel to those areas, though, they do run the risk of coming back to Mississippi or other parts of the United States and potentially infecting local mosquitoes that can lead to local transmission. But there's also sexual transmission that can occur.
And so if a man, for example, travels to one of these hot zones, as we've called them, and is infected with Zika, comes back here, what are the typical symptoms of someone like that?
Well, the symptoms would be the same. If somebody comes back and they're infected with Zika, and they have some of those symptoms that are consistent with infection, like fever, rash, joint pain, conjunctivitis, those kinds of things can be definitely a sign that they need to not have unprotected intercourse or try to have a baby for at least 6 months. But, you know, even people who are showing no symptoms, remember that about 80% of folks who come back who have no symptoms, only about 80% of folks have symptoms who are infected. So there still is a risk that they may transmit that sexually.
So anyone, male or female, who travels to one of these areas, when they come home to the U.S., what should they do? Well,
they need to take precautions to prevent sexual transmission. So for males, and this is a complicated message that may change down the road, but the current guidelines are for males who have symptoms or have been infected and have traveled to those areas, they should abstain from intercourse or have no unprotected intercourse, and certainly don't try to get their partner pregnant for at least 6 months.
6 months.
At least 6 months.
And after 6 months, at least according to the current guidance,
yes,
everything should be okay. If you haven't shown symptoms, we can assume that you don't have Zika.
Right.
Is there a test you can get done to see? Because if you return from one of those areas, or if you fear you might have it but are not showing any symptoms, can a test determine if you have it or not?
There are tests that can determine if you're infected right now. Currently, those tests are not recommended to determine if it's safe to conceive.
But they can determine if you have Zika or not.
They can. If you're symptomatic, they can. So that brings up another good point about what the testing recommendations are. Currently, from the Department of Health, what our recommendations are, any individual who's traveled to one of these areas or has had sex with a partner who has traveled to one of the areas with ongoing transmission and they are symptomatic, they should be tested. Any pregnant woman should be tested if she's traveled or has a sexual partner who's traveled. We test them whether they show symptoms or not.
Let's talk about the effort to prevent this and to cure it. What's happening with research toward a vaccine?
Certainly there is a lot of ongoing research for the development of vaccines, and that certainly could be promising. We're still a ways off before we have a vaccine that would be effective and would be utilized widespread. So I think the real take-home message now is that there are some things that can be done at this point to prevent infection. Certainly, if you do travel, if you have to travel, avoid mosquito exposures as much as you can.
And if you have it, what's the treatment for it?
You know, this is supportive care. It's a mild illness. So, you know, it really, in most people, does not cause a significant or severe illness. Most people recover within just a few days, and it doesn't require hospitalization. It doesn't require any specific treatment.
Do you think enough is being done on the national level to fight this?
I think so. Certainly, it always comes down to funding as well. They are using some monumental efforts in these areas in Florida where there is local transmission, and that requires a lot of resources. And certainly, we are working hard at the Department of Health to make sure that we get those messages out, that we work with docs to make sure that testing is available, and to make sure that folks understand what they can do to prevent infection.
We are getting close to wintertime here in Mississippi. It comes later here than it does for a lot of the country. Do you anticipate that as the weather turns colder around the country and the prevalence of mosquitoes is reduced, that this threat will be lessened?
You know, that's going to be hard to say, I think, at this point, and hard to predict about what that threat is going to be. We know that in these areas where there's active transmission now in those countries in South America and Central America and the Caribbean, that they are in certainly a more temperate zone where they may have mosquitoes year-round. And so travelers to those areas are going to need to take the same precautions regardless of what time of year it is.
State epidemiologist Paul Byers, please stand by with us a moment. We'll visit with you some more in just a moment. When it comes to West Nile virus, there's been one death in Hinds County and more than 20 confirmed cases in Mississippi this year. Those cases have been reported in Calhoun, Chickasaw, Copiah, Hinds, Grenada, Lamar, Lee, LaFleur, Lincoln, Lowndes, Marion, Perry, and Rankin counties. Mississippi had 38 cases of West Nile for all of 2015, and one person died. The state health department has an aggressive program to monitor mosquitoes and the illnesses they carry. MPB's Desiree Frazier reports.
This is Wendy Varnado.
West Nile is really our primary concern. It's here year after year. It's going to be here year after year.
She's a public health entomologist for the Mississippi Department of Health.
Well, an entomologist basically studies bugs, and then depending on what their field of study is, everybody has a unique niche. Mine just happens to be bugs of public health importance.
It's her job to monitor mosquitoes. She's looking to see when mosquitoes begin appearing, how abundant they are, and if they carry diseases like West Nile.
We're wanting to try to collect it in the mosquitoes before we start seeing West Nile show up in people. If we collect it and find it in the mosquitoes, then we're able to contact local mosquito control, and local mosquito control can go in and do abatement activities.
On this day, Varnado checks mosquito traps she set in residential neighborhoods in Pearl and Jackson.
West Nile is typically more of an urban mosquito. It's an urban disease, and we typically stick our sampling to more urban areas. Mosquito loves humans, where humans live, anything about humans. This mosquito, common name, is a southern house mosquito, and it gets that name for a reason. It loves to do everything it can to get inside your home, and it's going to be most likely found breeding in containers around your home.
This trap contains hundreds of mosquitoes.
We will try to gear our trapping towards those where we see the most human cases show up. Now, and that's typically the most urban areas. West Nile is everywhere throughout the state, so anyone throughout the state is at risk getting West Nile.
On down the road, she checks stagnant water in a drainage ditch.
West Nile is here, it's in your backyard. There's West Nile transmission going on as we speak between mosquitoes and bird populations. So West Nile is actively circulating right now. We currently have human cases of West Nile this season. So it's best to be worried about, for sure, diseases that you know are occurring and circulating right here and right now where you live.
After she collects the mosquitoes, she returns to the State Department of Health laboratory. She kills the mosquitoes by freezing them, then places them one by one in small vials for testing. She collects and tests approximately 50,000 mosquitoes each year.
In the summertime, folks like to get out and enjoy the quality of life. They like to get on our trails. They like to be in their backyards, and they don't want to have to fight mosquitoes. So that's just something that's important for us to do as a service to our citizens.
Gene McGee is the mayor of Ridgeland. His city, like many cities and counties in Mississippi, has a mosquito control program. McGee says the city sprays for mosquitoes in neighborhoods and responds to special requests by residents for more protection.
During the mosquito season, we began to spray our entire city, all the streets, both public and private, once a week. We also do, if someone has a special request where there may be outside activities that would need extra spraying, we also will provide that. And per request at no charge to our citizens, if someone needs some larvicide tablets to put in maybe a area that breeds mosquitoes, we can also furnish those.
Desiree Frazier, MPB News.
Contracting West Nile virus can be painful and even deadly. We spoke with a man from Columbus, Earl Harris, who describes what it was like to survive West Nile and what his life is like now. This is Earl Harris in his own words.
It was around June 2013. Started having, it started off like I was having the flu or a virus. Then I started having cold chills on one side of my body, and then I was red hot on the other side of my body, and then it got to where I couldn't move, and everybody thought I had a stroke when it first come down. And then they put me in the hospital, and they kept running all these tests and doing stuff. And first they thought I had Lyme disease, and then they ruled that out. And then they started doing more tests, and they knew it was some kind of insect infection or something, but they just didn't know what. I was in the hospital, I think, for around 10 days, and my temperature would run up to like 107. They just kept giving me medicine and doing tests and changing out sheets. That's all I basically remember of it. It's affected my memory, my eyesight. It affected my liver, my kidneys, and my colon, my nerve system. I mean, it's just you wouldn't think it until it happens to you. It's like you never get over it. One day you feel good, and the next day it's like you wore out, and you just have no energy or nothing, and so you just it gets depressing. They was running all types of tests on me, and they would give me different types of medicine to try to break the fever, and then when they thought they had the fever broke, it would come back. And like I said, at the time, I was so sick in there that I don't know all the stuff I was doing. I do know this: they took a lot of blood from me. I had a family I had to worry about taking care of, and I felt like I'd get better real soon, but over the period it's had, it's went down. I started getting a little better, and then it started happening again. Then I had a relapse around June, July in 2015, and it was like all over again. It was just like it just started all over again and pulled me down, and that was pretty much it. It took a toll on all of us, and you know, the Lord's what kept us together, because I lost my business. I couldn't maintain my work. I couldn't deal with clients. So if you can't work and you can't deal with clients, you can't make a living. And I didn't have no energy, and my head hurts all the time, which it never goes away. I would wear out so fast, I get so frustrated, and it just I didn't want to be around nobody. You'll be out talking to somebody, and they say, "Well, I've had West Niles. It ain't, you know," and you sit there and say, "You know, you don't want to wish this on your worst enemy, because it affects you internally, it affects you physically, and it affects your everyday life." I have headaches 24/7, and when I say 24/7, I've got a headache right now. But sometimes of the day, it gets to hurting so bad, you know, no matter what you take for it, you know, it doesn't help. You say you don't have no energy. I have no control over it. I mean, I can be looking like I'm feeling good, then all of a sudden I've got to go lay down and go to sleep. You know, and in my head I'm saying I don't want to go to sleep, but you're gonna go lay down, because you're not going nowhere else. It messes with you. You know, you have aches and pains in places that you never knew. You know, and it affects you because you can't get out with your family and do the everyday things that you're used to doing. You know, used to you could jog a mile or something like that. Now you do good to walk to the mailbox without, I mean, having to sit down. You run out of breath. It affects it impacts your whole body. It's impacted my life real bad. When you're ill or you're disabled or something, you know, you've got physical things they can look at and tell. This is something you can't just look at somebody and say, "Hey, look, you know, he's in bad shape." It's just not that type of a disease. West Niles it's something so small that can do so much major damage to you that, you know, you need to take all your precautions. And if you don't know anything about it, start researching it, especially if you've got children, because if they love to be outdoors, make sure they're prepared to best they can to keep from this, because it really affects your lives.
And we welcome back Dr. Paul Byers, state epidemiologist. Let's talk about West Nile now. What exactly is West Nile?
Well, West Nile is a mosquito-borne viral infection as well, so it's transmitted through the bite of an infected mosquito. It can cause an illness of fever, sometimes a rash, certainly a headache. Most people have relatively mild symptoms, flu-like illness, but in some cases it can cause a more devastating neuroinvasive disease with encephalitis and meningitis, sometimes a paralysis, and the recovery time can be very prolonged in those cases. Unfortunately, it can lead to deaths as well.
Well, seems to be such a wide spectrum of a mild flu-like illness up to death. What's the difference there? Is it the difference in the type of mosquito that bites you, or is it a difference in your condition already as a human?
We see it more as age a predictor of those folks who are going to have more significant complications from West Nile. Those folks with neuroinvasive disease, their risk is increased in people over the age of 50, actually, and that's where we see most of our West Nile encephalitis and meningitis.
West Nile's been around a lot longer than Zika in Mississippi. What, 15 years ago was the first case
2001 here? Was our first human case in Mississippi.
And how serious is it of a threat still today in Mississippi?
Well, it doesn't look like it's going away anytime soon. Certainly we have some variability from year to year on the number of cases that we have. And this year has been relatively mild when we look at previous years and the number of cases. But you know, the big deal is that West Nile is around, it's here, it's in our Mississippi mosquitoes, and it can lead to some devastating illness and in some cases deaths.
Zika is a new thing. It seems to be grabbing all the headlines now. Is that at the expense of West Nile? Is West Nile a larger threat to us than Zika is?
Well, you know, West Nile is one of those things that we're all at risk of if we're outside and we're exposed to mosquitoes here in Mississippi. For Zika, you still need to travel to those areas where there's ongoing transmission to be at risk. So, yeah, this is something that Mississippians need to be aware of because we do have it here, and it's not going away, it doesn't look like, anytime soon.
Nor are mosquitoes. They're a fact of life in Mississippi. We've dealt with them all our lives, and as long as Mississippi's been here, it seems. So if they're so prevalent and we've got 2 potentially deadly illnesses that they can transmit to us, how on earth do we protect ourselves?
Well, you know, you need to be looking around your house for areas that mosquitoes can breed. You need to get rid of those areas. You know, dump out that water, clean out those gutters, make sure that there's no places for the mosquitoes to breed. When you go outside, use mosquito repellent, especially for West Nile. If you go outside during the times of day when this mosquito is most active, in the cooler times, evening and early morning. And with this mosquito that transmits West Nile, we know that it can be year-round. Certainly in the summer is when we see most of our cases and most of our activity. But we have had infections reported to us as early as January and as late as December in Mississippi.
Very good. Dr. Paul Byers, state epidemiologist, thank you for your time. For more information on Zika and West Nile virus, go to our website, mpbonline.org/issue. You can find the full-length interviews we conducted with people on this program, as well as additional information and links. But for now, we're out of time. Join us next week for another edition of At Issue. Good night.